Hi, I am going to speak about my um, career that I found, and I wanted to research more about a substance abuse counselor. And I found one job listing online that called for a substance abuse counselor at the Ryer Avenue Adult Daycare Center in the Bronx, New York. And they provide housing and counseling services for those that are in need due to homelessness or substance abuse. And the career contact is Katrina Moore. And the working environment for a substance abuse counselor in general is you could lead Alcoholics Anonymous or Narcotics Anonymous meetings. You could work for the community centers or public outreach programs, YMCAs, hospitals, residential treatment facilities, or even government facilities such as prisons or juvenile detention centers. And for the nonprofit position I researched, the job was a counselor in the housing development day care leading classes or assisting those with addiction problems through Alcoholics Anonymous or Narcotics Anonymous meetings. When I was researching the career profile of that of a substance abuse counselor, it really made me excited about this position and think that this is something that I could do as a future or potential job. But some of the typical stressors was typical to that of just counseling or family studies in general, which is emotionally exhausting. And they highly suggest it requires stress management and trauma coping skills. And a lot of the time that you have to talk to someone who is under the influence, and sometimes they're undergoing a crisis. And so the stressors are that you have a lot of different people with emotional problems and living situations, so you have to be able to keep your cool and keep your emotions stable. The substance abuse counselors are often advised to receive their own individual counseling or therapy to make sure that they are receiving their own support and taking care of themselves so that they can help other people. The nonprofit that I researched includes benefits, and that included full health, dental, and vision, and also a 401k. And the thing that I liked the most was that there was an incentive through tuition and reimbursement if I wanted to go back and get my master's per se. Um, the common job tasks were obviously listening and speaking skills and be able to communicate with the broad spectrum of people that have various needs or problems. And compassion obviously is a big one, especially because the people that you're dealing with have severe challenges that they need to be talked to, and you need to be able to be calm under stress and maintain a healthy relationships. And also, it says that you shouldn't have problems with substances of alcohol and painkillers yourself, obviously. And they say that a substance abuse counselor, it's encouraged that these people are confident and optimistic, because the people that they're dealing with, individuals who have substance abuse, you're usually helping them through their recovery, and that could be very long and tedious. And so, to have an optimistic and confident outlook would be a good thing to have. Some of the job tasks would be to interview and assess clients' addictions and mental health issues, and then walk them through a treatment program, either through AA or NA. And they can also assist them with their Alcoholics Anonymous recovery steps and use of drugs like methadone and behavioral planning. And sometimes you can work with the family, the client's family, to find the best plan of treatment for them. If they don't work with specific individuals, you could work in a treatment or a outreach programs in schools or communities, informing people about addiction prevention. So there's not just one-on-one opportunities. The educational requirements were they depend on the state and the job title, but generally programs most likely require a master's degree or a bachelor's, I meant. People who wish to do one-on-one counseling need to obtain an education in psychology or mental health treatment. And in order to operate in private practice, the counselor must have a license. The starting salary, just starting out, would be 25,000, and the experience salary would be 61,000. So that's quite a different lead. The pay is high, and I just found this interesting. The pay is the highest for counselors who work in hospital settings. And the thing that I really like the most is the Bureau of Labor Statistics expects jobs in this field to grow by 31% from the year 2012 to 2022, which is much faster than other average job growth. So I think that's it. This was actually an occupation that I could really see myself doing.